Good morning, everybody, and thank you, Alison, for introducing me. As Alison said, I'm Jane Parkinson, and I'm very pleased that Tam has very ably set the scene. He's highlighted some of the points that I wanted to highlight as well, so that's fantastic, so thank you. And really set the scene for the importance of the need to assess the mental health of Scotland's children. And I am very pleased and very excited to be here today to share with you and launch the indicator set. And this is a combination of a 3.5-year piece of work, and it will ensure that we will be able to assess the mental health and its context of children within Scotland and help inform decision making. Now, I previously created a national indicator set for adults, and this was completed at the end of 2007. And then there was a data report for this in 2009, which is currently being updated and will be released next year. So this work follows on from that. All the outputs from the work are available and will be available on the URL at the bottom of this slide. And so initially, before I continue into my presentation, I'd just like to thank all the many people who have informed this piece of work and helped ensure that it does link with all these agendas. Especially like to thank the Expert Advisory Group, and I'd also like to thank my colleagues in the Public Health Observatory at NHS Health Scotland. So if I now then move on into the presentation, this slide just shows you what I'm going to talk about. I'll talk about background to the work and the process that was undertaken just to set the scene and go through some of the supporting work that was commissioned to feed into and inform the work. Before moving on to the main body and what I know you're all very interested and really here to hear about today, about the indicator framework, I'll take you through the indicators and highlight the data gaps where we need new data, ideally, to be collected in the future. I'll then highlight some of the key issues that emerged in the course of the work and link to the relevance of the work to the many other policy agendas that it touches on, before moving on to the next steps and ending with some of the key messages that I would like you to take away with today. So if I just initially talk about the background to the work, the aim was to produce a national set of sustainable mental health indicators for children and young people. And this was to fulfil commitment number 4 of the Scottish Government mental health policy document towards a mentally flourishing Scotland, or TAMPS, as many people know it as. This is now, there's currently a consultation on a new mental health policy document, but this is a commitment to number 4 of that policy document. And this mental health is to create the indicators that will then allow us to produce a mental health profile for children and young people so we know what is happening to their mental health and whether initiatives and other things in Scotland are helping improve the mental health of children and help inform policymakers and planners about where focus is needed and action and resource allocations need to be made, and also help inform future policy development and link to the accountability of part of the wider national outcomes framework of the government. So I then just want to give you a flavour of what the indicators are sort of covering. Now, I'd like to point out that mental health, there's no agreed definition, but it's important that the way it's conceptualised will affect the way it is measured. So for this work, we've taken the term mental health to cover 2 separate dimensions of mental health. This is mental well-being and also mental health problems. The work has also taken a public mental health approach. This is a population-based approach to understanding and addressing the risks and protective factors for mental health. And it recognised that mental health is relevant to everybody, all children and young people, and all people in the population. So the indicator set has indicators that are to inform and report on the state of people's own mental health, both well-being and mental health problems, but also the contextual factors, the things that are impacting on their mental health. The indicators are at a national level, but they are suitable for use at a local level, and where possible, we've used data sets that have a large sample size as possible to allow disaggregation to more local level. The work covers children and young people from pre-birth to 17 to fit in with the UN definition of the child. But there will be some indicators that are about adults if features of adults, such as their behaviour, impacts on the mental health of children and young people. And finally, the indicators about the whole population of children and young people, all the children within Scotland. Now, the process, as I said, I'd already developed adult mental health indicators, so I was able to build on that experience and capitalise on that. The work took a mixed approach. This was taking into account the policy, the evidence, expert opinion and theory, and importantly, what data is currently collected within Scotland, so that the indicator set is more than just a wish list, but as Tam pointed out, it's not been limited by what data is collected, and we do have some indicators that are dataless and hopefully will push forward to get that data collected in the future. The work has been informed by an expert advisory group, and this was very wide-ranging advisory group. As Alison said, she was the chair of the advisory group, and there were representation from the government, various aspects of policy, from public health, children and young people, to education. There were also experts from throughout the UK, not just Scotland, and the expertise covered research, the evidence base, data, and there were voluntary sectors like Children in Scotland and also Learning Teaching Scotland, as was at the time. It's now obviously moved into a different body. Initially set out to identify the desirable set of indicators, what in an ideal world we would like to have as the indicators for children's mental health. Looked at what data is currently collected on a national basis, because these are national indicators, so it had to be data that was available to cover the whole of Scotland. And then we could marry the two together to identify those indicators that we currently can report on now with the data that we already have in Scotland. And obviously this identified some data gaps between what we ideally want and what we can report on now. And so a push, obviously, to collect new data in the future. The indicators are structured within a modified adult indicators framework to allow some continuity, and this was consulted on in 2010 by 3 different mechanisms, and some of you might have been involved in the large stakeholder event that we had here in March 2010. There was also an electronic consultation for key experts, organisation and practitioners, and then importantly, the views of children and young people were taken into account in this work. We had a consultation with various groups of children and young people, and I'll talk a little bit more about this in a following slide. But this was a piece of supporting commissioned work. And for the work, there were 3 pieces of commissioned work, and then there were, as well as the big national events, there were some smaller events with Scottish Government colleagues to make the links across separate agendas and data initiatives. So if I now just move on to the commissioned work, as Alison and Tam have sort of alluded to, it's been very important for this work that the views of children and young people and what they think impacts on their mental health was taken into account in the work. So the first piece of commissioned work to seek to do that was a commissioning of a literature review by Shuck-Smith et al. In 2009, and they looked at both the grey literature and the published peer-reviewed literature for the views of children and young people of what they think impacts on their mental health. Then this highlighted that there are some limitations of the evidence base in that there are some groups of children and young people, many vulnerable groups of children and young people whose views aren't present in the literature, either completely absent or underrepresented. So when we were consulting on the draft framework, we thought it was important that these children and groups of children were consulted on. And so there were 9 focus groups undertaken by Elsley and her colleague Macmillan to gain their views, to see if the framework chimed with them, if there was anything that was being missed. And then the third piece of commissioned work was to validate the Warwick-Edinburgh Mental Wellbeing Scale, which is called WEMWEBS. For those of you who aren't so familiar with this scale, it was developed in the course of the adults' work to assess mental well-being, as currently we didn't have a validated scale to assess the mental well-being of the Scottish population. It was validated for those aged 16 and above, so commissioned Warwick and Edinburgh universities to validate it for children aged 13 and above in the school setting, and it proved to be a suitable population measure. And then I managed to influence the Scottish Schools Adolescent Lifestyle and Substance Use Survey to include this measure from 2010. So we will now have data related from 2010 on mental well-being of certainly children aged S2 and S4 in that survey. So if I now move on to the main body of the work to introduce you to the indicators, and I'll run through and the indicator set. this is a summary of the framework. And there's two aspects to it. There's the high-level domain and then the contextual domains that Tam talked about. The area of the individual, family, learning environment, community, and structural. And the difference to the adult framework is the area of the family and learning environment. So if I then look at the full expanded framework, there again you have the high-level constructs, of which this is the state of people's mental health. So we have mental well-being and mental health problems, recognising the two sides of mental health. And then the contextual constructs, the things that impact and can influence and also are influenced by mental health. So we have the area of the individual, and these are the various domains underneath. The family level, learning environment, community, and structural. And as I said, this has been was informed by the views of children and young people, the evidence base, expert opinion, policy, and what data is collected. So if I now actually turn to the actual indicators themselves, which I'm very, very pleased to be able to share with you, and you will all have been given the briefing paper that lists them in their entirety. There are 109 indicators in all, but some of them have multiple measures, multiple ways of reporting on them. Some, and I'll illustrate this as we go through, some are dataless, and again, I'll illustrate these as we go through. But a feature of the work was that it was important that these dataless indicators were included there so that we can highlight the things that are fundamentally important to children's mental health and keep these things on the agenda. So if we start with the high-level domain and the area of mental well-being. Now, this slide shows you how the indicators are presented in the briefing. The following slides are more summarised because there's a lot of information, but I just wanted to show you and go through how they're presented. So on the left-hand side, we have the name of the indicator. In the centre, we have the measure, what actually the data is that's collected. And then on the right-hand side, we have the data source, where the data is coming from. So if we look at the area of mental well-being, there we have two separate measures, and this is where I say for some of the indicators we have two different data sources, and this reflects the fact that certain data sources don't cover all the ages. For the adult indicators, the surveys collected data from those the whole range of the adult ages, but for children it's a little bit more complicated. So here in the area of mental well-being, we have the Warwick-Edinburgh Mental Wellbeing Scale that I just mentioned that we commissioned the validation of for children. We have data for those aged 16 and 17 from the Scottish Health Survey, and then we have data for S2 and S4 pupils from the Scottish Schools Adolescent Lifestyle and Substance Use Survey. And these are exactly the same measures using the mean score on WEMWebs. If we look at life satisfaction, again, we have two measures. These come from two separate surveys, the health survey for 16 and 17-year-old and the health behaviour of school-aged children for those aged P7, S2 and S4. And whilst these things are both assessing life satisfaction, the data is collected but using slightly variations, different questions, but they still do assess life satisfaction in its entirety. I will illustrate further on some indicators where the measures are actually different, for example, school ethos, but I'll highlight that as we move on. So if we then go and look at the dataless indicators for mental well-being, looking at mental well-being and overall assessment of mental well-being itself, we haven't currently got any data collected in Scotland for the younger age groups. And so these are highlighted here, the need to collect for these separate three age groups. And obviously, I think many of you will appreciate that for children, one size doesn't fit all. You need to get the data using different means of collection, which is why we have three separate dataless measures here. I now move on into the area of mental health problems. And I think you'll immediately see that we've got more indicators in this area. And I think this reflects the historical focus that there has been in the mental health field, more on mental health problems. But obviously, things are changing, and mental well-being has moved high up on the agenda, and now we do have data collected on it. If we move on to look at the dataless indicators, we have a dataless one. Again, it's for the very early years for emotional and behavioural problems. We do have data. This is from the Strengths and Difficulties questionnaire for older children. We have it for those aged 4 to 12 from the Scottish Health Survey, and those aged S2 and S4 from the Scottish Schools Adolescent and Lifestyle Substance Use Survey. But we don't have the data for the very early years, so this is needed. And then if we look at the bottom, we have 2 indicators for which there is no data at all for the indicator set, and this is self-harm and eating disorders. And I'd like to qualify that when I say there's no data, there's no robust data to inform national indicators for reporting trends over time. For some of these indicators, there might be some data, but it's not robust enough for the purposes of national reporting of indicators. So if we now go on to look at the contextual constructs, the things that impact and influence children's mental health. And we start off in the individual domain, and these just show the constructs, so the areas within which the indicators are placed. So we've got the learning and development, healthy living, general health, spirituality, emotional intelligence, and life events. And if I then go and highlight the indicators for which we have data for, I think you can see that these are in the areas more as behaviour and of general health and physical health overall. And then when we look at the dataless indicators in these areas of learning and development, there's dataless for play, but there are some moves within Scotland to look to create play indicators that might be suitable for this indicator. And then readiness for school. And there is work within Scotland to pilot and test out the early development instrument. And if that proves suitable, that might be a way of collecting the data in the future. And these 2 strongly link with the early years framework indicators of the Scottish Government. If we then look at the bottom for spirituality and emotional intelligence, now these are 2 areas that were also dataless for the adults, but it's important to include them in the indicator set because they are considered very important for children's mental health. But for both of these, further work is actually needed to try and understand more and better what these mean for children and young people, and then to identify what is the best to be assessed. So if we now move on to the family domain, and this is a new domain that wasn't there in the adult work. This shows you the family, the constructs, and importantly, family relationships are right up there at the top. And this is the area where we have some indicators about adults in the parental healthy living and parental health, because these things can impact on children's mental health. If we look at the indicators themselves, and here I'd like to highlight the fact that for some of these indicators we have separate measures for mothers and fathers. It's been very important amongst the discussions in the expert advisory group that the importance and presence of fathers within Scotland and for children's lives isn't forgotten in the indicator set. So for instance, if we have talking to parents at the top, there's one about talking to mothers, and separately a measure for talking to fathers. And then again, for parental imprisonment, there's the children who have a mother in prison and children who have a father in prison. If we go on to look at the dataless indicators, and here you can see that there's several gaps around maternity. Now, there is data collected in Scotland around, for instance, maternal use of alcohol and maternal drug use, but it's not robust enough currently for use as a national indicator. But there are moves, and there is work ongoing to improve this. So hopefully in the future, the data will be robust enough to populate these indicators. And now move on to the learning environment. And here I'd like to point out in the contextual that from the literature, children clearly identified peers as very separate to friends. And so that is reflected in this construct here as two separate entities. And at the bottom, we have pressures and expectations. Now, this was something that the children and young people identified it was from the literature of what the children and young people said as a new area that has arisen from what they feel impacts on their mental health. Over 10 years ago, children didn't mention this as an important area. So it is certainly an up-and-coming area and very important to include in the indicator set. We go and look at the indicators, and on this slide, I think you'll see that we've got quite good coverage of all the indicators, and this reflects the fact that we have 2 school surveys within Scotland. We've got the Scottish Schools Adolescent Lifestyle Substance Use Survey and also the Health Behaviour of School-Aged Children Survey, but they collect from S2 and S4 and P7, S2 and S4 respectively. And obviously, the area of friendships is very important in this indicator area. If we move on to look at the dataless indicators, here you will notice that this area isn't just about school, although that is what we currently have suitable data to report on. It's about preschool as well. And so we have 2 indicators that are dataless about the preschool home learning environment and the early years friendships. And again, these link with the early years framework indicators. If we look, and I mentioned about the school ethos. Now, this indicator actually has 4 separate measures. The 2 indicators that we have data for in this area are being treated with respect by fellow pupils and keeping parents informed of what is happening with their children. And it's the 2 dataless ones that reflect the curriculum for excellence. So this is a measure on wider successes, recognition of the school to wider successes than just academic, and the overall school ethos. And as I said, this links in with the focus and the ethos of curriculum for excellence. So we're working our way through the domains, and we now move on to the community domain. And here we've got the constructs, and here we have participation, social networks, social support, trust, and safety. And this area links very clearly with social capital. Although this concept of social capital isn't so clearly defined and understood as to what it means for children and young people, it's a very adult concept. And so there is some work needed in this area as to what this really means for children. If we look at the indicators for which we currently have the data that we can report on, and here we have influence in local decisions, participation in clubs, social support, neighbourhood trust, and neighbourhood safety. And I think you will see that, as Tam said, it really does chime with many things coming out of his consultation. If we look at the dataless indicators, and again, Tam noted the 2 at the top, a sense of agency and respect of children's rights was clearly linked to the Children's Rights Bill that is currently being consulted on. And then we have the one with contact with peers under social networks, and this is where actually further work is needed to try and understand what social networks mean to children in today's current society. With the advent of modern technology, social networks are very different to how they were in the past. So more work is needed to identify what would be best to be assessed for this measure, and then obviously move on to the next phase, which is trying to get and influence the data to be collected within Scotland. And then finally, if we look at the area of the structural indicators themselves, and here many of these areas relate to household, what's going on in the household. You can see we've got equality, social inclusion, discrimination, physical environment, violence and culture. And if we look at the indicators for which we have data, and I just want to highlight on this slide, I wanted to keep all the indicators on one slide for you in this area, but it has meant that I've had to put more than one on the line. So if we look at the very top, there's actually 3 indicators on this top line. They are separate indicators, but it's just for representation purposes for this slide. So we have an indicator for absolute poverty, a separate one for relative poverty, and then a separate one again for persistent poverty. And these 3 indicators link to the UK child poverty indicators. You will notice that there's good coverage in the area of the equality, and we've got one indicator there, quality analysis, which means analysing all the other indicators within the set by equality dimensions, where we have the data that will allow us to do that. It's not always possible, and certainly for many of the equality dimensions and protected characteristics, we don't have the data, but we can in some places analyse by age and by gender and things like that. We have the area of social inclusion, and again, we have good coverage of the data here. And in the physical environment, we have some good coverage, but quite a few of these do relate to the household level that the children are in. And if we look at the dataless areas, we have these 2 clear areas here where we have absolutely no data for the construct, and this is discrimination and violence. And again, when I say we have no data, it's no suitable data, because in the area of violence, there is data collected on domestic abuse and child protection, but it's not consistent enough across the national picture, and so it would give a false impression if we analysed it on a national basis. So I hope that's given you a good feel and a good run through the whole of the indicator set. And you can see the breadth and the depth and the many, many agendas that it can link into, where we need new data to be collected and we should be pushing for that data, and where we currently can report. And I highlighted a few things as I went through, and I just now want to take you through some of the issues. One is the evidence base. Now, a lot of the evidence base does come from the evidence about what is important for mental health problems. And you can't always necessarily assume that what impacts and affects and causes mental health problems is the same for mental well-being. But with the new scales being developed, we can start to assess the determinants, the factors that influence and are associated with mental well-being. We also don't always know the direction of causality, and for some of these indicators, they are both causes and consequences of mental health, and we need more longitudinal data to be analysed to get at direction of causality. I've touched on some of the issues with the data source. In some areas, you would have seen that there is some limited age coverage. As I mentioned, for the adults, one survey would cover the whole of the age range, but for children, it's not the same. In many instances, there's just a school population survey for certain age groups. So we haven't got coverage for all of the indicators across all of the ages. And this also leads to the fact that in some instances we've had to have multiple measures because the surveys have collected data on subtly different things, or in some instances we wanted to report on an indicator using by different aspects of that indicator. In a very minority of cases, we have extended the age range. So said at the beginning, the ages fits with the UN definition of the child of 17 and under. For 1 or 2 of the mental health problem indicators, we have extended that to 19 years. This is purely to allow there to be enough robust data to report on this indicator. And then in the structural level, some of the indicators matching to the UK child poverty indicators have gone above 17 because they're matching the definition that is already used in those indicators. And that is very important, that where there have been other indicators, we've aligned and kept the same definitions. As I mentioned, we have looked at data sources that will allow as much disaggregation to a local level and a subnational subgroup level as possible, but that does have limitations. And it might be that local colleagues will need to collect their own data later, or look to supplement with some other data that they might have locally collected. There's also the issue of slight representativeness of the data that's collected, because some of these surveys are household level, some are school-based, and also for some of the data is collected as self-report, but others are reports by the parent or the guardian of the child. And then finally, very important to the work, is trying to ensure sustainability of the indicators, that the data remains collected in the future and that the questions remain in the national surveys. And then we've talked about the data gaps. And these cover all ages, but I think especially the very early years. And the early years are very important for children and young people. The data gaps cover the whole area all throughout the whole of the framework, but there are some entire constructs, such as the learning and development, discrimination and violence, where we don't have any data that can be used to report on any of the indicators in these areas. And then for some of the areas where we are dataless, there actually might not be, and there aren't, suitable tools and questions readily available now that we can use to collect the data. So there's a further developmental stage might be needed to create scales and suitable questions that could then be placed in, for example, a national survey to collect the data. There are various recommendations coming out of the work. There's 43 in all, which sounds an awful lot. 38 of them are around the data gaps. And obviously, that's a huge number, so we will be looking to prioritise the essential ones. But we have, where possible, linked these recommendations to data initiatives that are already going on in Scotland to seek to improve national data collection. So this is another aspect of where the work needs to link with other agendas that are going on in Scotland. Which leads me on to the key issues of raising awareness of the work and influencing the data collection systems. And as I said, I was fortunate to get the Warwick Edinburgh Mental Wellbeing Scale, which assesses overall mental wellbeing, into the Scottish Schools Adolescent Lifestyle and Substance Use Survey, so that covers S2 and S4 pupils. We're keen to align the work with wider policy initiatives. And so we've linked in and looked at the indicators that are present in the early years framework. We've looked at GERFEC, we looked at Curriculum for Excellence, and trying to link in with these and linking in with other policy colleagues. And for this end, we have had various meetings with Scottish Government policy colleagues and people who are involved in the data collection and the surveys to try and identify overlapping data needs, overlapping agendas, so that we can work together to push forward to get the data that will be appropriate for many separate agendas to inform on them. And this slide shows you some of the links of the work to various policies and initiatives within Scotland. It's not exhaustive by any means, but it gives you a flavour of the wide range of things that the work impacts on. And this is, it is presented here in this what I think is quite a powerful visualization. At the centre, we've got mental health and the indicators and the things that it can impact on, the main summary areas, health, education, equality, crime, and then more detailed aspects around and linking at the very outset outside to some other indicator sets and things, the National Performance Framework and some of those indicators. So I think you can see the huge cross-cutting nature of this work presented in this slide. So if I just now move on to the final summing up stage of my talk, the next steps is to finish the final report to the work, which will be out very soon, and then we move on to reporting on the data. I mentioned at the beginning there was an adult set of indicators, and currently we're working on a revised data report for that, which will be completed next year, and then work will move on to start the work to report on the children's indicators, analysing the data, pulling it all together and presenting a good picture of what this shows and what it can help inform policy development. There is potential wider use as well of the indicators, and we've got various examples for this from the adult indicators. The indicators are a resource and potential to raise awareness and understanding across many partners about the things that influence the mental health of the children and young people locally. So if we look at some of the things that have come from the adults indicators, the Glasgow Centre for Population Health has used the indicators to create a local mental health profile. The indicators have been used to help inform strategic thinking for mental health strategies locally. They've been used to help create a mental health improvement outcome framework of NHS Health Scotland, and are very useful in logic modelling for outcomes. They've helped inform people for their single outcome agreements, and overall, I think they've strengthened the links to the contextual factors, the things that impact and influence and are influenced by mental health. So in the future, there will be, as I mentioned, we will be reporting on the adult data, and then this will be updated every 4 years. Maintenance and sustainability of the indicator set needs to go on to ensure that they can be reported on in the future, and then obviously work to try and gain the data for the dataless indicators. And there's agreement to establish a national steering group to help steer that and future direction and keep the indicators up on the policy agenda. So if I just leave you with 3 key messages, I think it's safe to say that this is the first set of national mental health indicators for children and young people, certainly in Scotland. And I think it does mark a good push forward and to improve the mental health and overall health of our children and young people. I've highlighted the wide relevance to many far-reaching policy agendas, and also the indicators have been useful in this respect of pushing mental well-being, not just mental health problems side of mental health, but also mental well-being, and helping people understand that work in many areas impacts on children's mental health. And we'll be hearing about the links to some other policy agendas just after me. And then I'd like to point out that the work was done with a very comprehensive and multifaceted developmental process, so rigorous methods. We looked at primary research, secondary research, we had an advisory group and many other experts, and importantly, we included the input of children and young people. So on that note, I'll finish, and I'll just leave you up with my contact details and with the website links to all the outputs, as I said, will be on the Child Mental Health Indicators webpage, and the one at the bottom is the link to the Warwick Edinburgh Mental Wellbeing Scale. Thank you.